Hello, hello. Come on in, take a seat. Welcome to the ASMR Cranial Nerve Examination Clinic. Is this your first time coming in? Awesome. Well, it's lovely to meet you. Yep, we've totally rebranded, kind of changed locations, so we're definitely super excited about it. Now, do you have a referral today for a neurological concern, or is this more of one of those kind of comprehensive exams just to make sure that to us nothing stands out, but really it's more elective? Just an elective exam today. Yeah, no problem. Do you mind giving me your first and last name? Okay. And let's see, do you have a primary number? Okay. Got it. All right. And then do you have any allergies to anything? Any important medical history that you think we should be aware of before we do this examination? No? Okay. My name is Leanne and I will be the provider conducting your exam today, so very excited for you. And would this be the first time you've ever done an exam like this before? Have you gone to other clinics? Maybe a while ago. Okay, well, yeah, this is going to be super fun and exciting. It's always a fun little thing to kind of get done. Just, a lot of people are curious about their cranial nerve function, so that is great. So before we do these elective comprehensive cranial nerve examinations, I do just like to get your general vitals just to make sure that nothing stands out before we do this examination as far as health risks. Would that be okay? Awesome. So how about this? How about I get a notebook started here for you, or a chart. And this is basically what I am just going to be documenting as far as your progress for each of the cranial nerves. Okay. And then let me take this. We usually have the sheet that we go off of here. Awesome. So everything is set up for you. Let me just put some sanitizer on, get your general vital signs, and then those will give me the go-ahead to start with this cranial nerve exam. All right, so we are just going to start with the blood pressure first. Let me just get the cuff out of there. I'm probably going to use that arm if that's okay. Any history of having blood pressure difficulties? Okay. Does that feel good? Okay. Let's get this going for you. Give me 1 second. Pressure is normal, so you're all good there. Just take the air out of there. I'm just going to take this off of here. There you go. So blood pressure is good to go. The last thing we have to do is just a temperature check, because we take, flu viral precautions here very seriously. And then you will be all set to start this exam. Let's put this back there. Perfect. And then let me get my temperature check. So this is going to go right underneath your tongue. Going to go underneath. all set there. Put this back inside. Alrighty. Super, super exciting. You ready to begin your exam? Cool, cool, cool. These items super excited for you. Alright, so everything is all approved and good to go there. So if at any point you do need to pause for whatever reason during this examination, you just let me know. Absolutely, yep. Open communication is most important, of course. And yeah, we'll just get started here. I'm gonna put some gloves on. Was that not the most dramatic sound ever? Okay. Alright, so the first cranial nerve that we will be doing, pardon my pronunciation, is the olfactory nerve, cranial nerve 1, and this manages our sense of smell. And so what I'll be doing is grabbing a few vials that have various scents, and I'm just going to need you to identify these very common scents, okay? Let me see which scents you ended up with today's kit, so I can just track if you are going to get them correct. Very good. Let me see, how many should we do for you? Okay, so there's going to be 5, all right? We've made note of all the ones on your specific testing kit for you. They're all like each unique to the patient. So these are the different scents that we will be going for. All I'm going to do though is ask you to close your eyes, and then you are just going to identify the scent, okay? Awesome. All right. So this is going to be scent number 1. Close your eyes and just tell me what that smells like. Vanilla bean, very good. Okay, we're gonna grab the second scent here. So far, you're doing great. What's this one? Like toothpaste? Yes, mint. Yep, very good. Let's try scent number 3. This one's a seasonal one, I think you'll get. Most people do. Probably shouldn't have said seasonal. I feel like that probably gave it away. Okay, just keep your eyes closed. What does that smell like? Pumpkin spice, everything nice, yes. Okay, scent number 4. Okay, close your eyes. What does that smell like? Not rose. Yeah, that one was actually lavender. This next one is, or this last one is probably going to be the hardest. It's interesting. I feel some are able to note this scent, whereas others maybe it smells like nothing. I know that probably confused you, but for me this is very strong. For other people, not at all. Eyes closed. Yes. Yes, it's cilantro. I can smell this stuff from a mile away. Yes, I love when the kits include that scent because it's more of just interesting, because some people find it appalling and just nasty, and other people, like, not me, but people who don't have a cilantro issue, they say that they can't tell the difference between that and parsley, which to me is like crazy, because how can you not tell the difference? Okay, yeah, so fun fact about me, I absolutely can't stand cilantro. But you did great. Awesome. So cranial nerve 1 is complete. You can manages our vision, or parts of our vision. So I'm just going to ask you to read off of a little chart for me, but I'm going to cover each eye and then you'll read with both eyes, okay? Does that make sense? Awesome. Okay. So here is the little chart that we're going to be going off of, and here's my trusty eye cover. So we're going to cover this eye first. Okay, can you read the first line? Yeah. Can you read, what is the last line you could read confidently? Very good. All right, let's try the other eye. There you go. And what is the last line you can read confidently? Good. Yeah. Excellent. Very good. Now, I'm not going to cover either eye there. Let's do both eyes. Can you read the line that you can see, or the lowest line that you can read, like the smallest one? 3, 7, 2, 8. Very good. Your vision is spectacular. Good job. So, cranial nerve number 2 is complete. The next few cranial nerves manage a lot of sight, vision, eye movement, that sort of thing, so it may be slightly repetitious, just as a heads up. So cranial nerve number 3 is called the ocular motor nerve. This kind of manages a lot of pen light stuff, so how your pupils react to light, how they react to accommodation, something super close versus something far. So let's test your oculomotor nerve. Alright, so we're gonna test reaction to light. So if you could look kind of straight right at my finger here. And so I would expect your pupils to constrict. Great, just keep looking at my finger for me. Okay, ready? Keep looking. And what I want you to do is I'm going to grab my hand sanitizer here. So you see my sanitizer, right? Okay, look at it this close and look at it this far. Look at it this close and look at it over here. So we're seeing how your eyes react to accommodation of various distances. Very good. Awesome. Okay, cranial nerve 4 is the trochlear nerve. This is going to be following movement of the pen light. I'm actually going to be combining this with cranial nerve number 6, the obtusense, because they do similar techniques as far as managing the health of those nerves. So you are just going to follow the light. You're doing great. Oh, I forgot to mention, don't move your head. Like this. You're doing great. Back forward. There. Right. Left. Up. Down. Very good. You did great. Alright. So, cranial nerve number 5 is what we call your trigeminal nerve. And this tests a few different things. We're going to be testing your blink reflex and also like light, sharp, dull sensation of your face. So there's a few different things that I will be doing for this portion of the exam. The first thing is testing your corneal reflex. So don't worry, I'm not going to, just going to be taking this cotton ball, kind of making a little point to it, and I'm just going to be getting close to the corner of your eye to see if it elicits a blink, okay? Okay. There's the blink. Again, look forward. Yes, there's the blink. Okay. Blink reflex is very good. Let me put this back. So to test light sensation on the face, I'm just going to ask you to close your eyes and you're going to feel a light gust of air. I just want you to let me know when you feel that sensation, okay? just going to be testing different areas. Good, good, good. Let's do more of like a, let me see, more of like a more dull sensation. So keep your eyes closed. Let me know when you feel. Good. Good. Yeah, this is more like a deeper pressure and sensation. Very good. Excellent. Do you need a break at all, or you feel like you're doing okay? Good. Just want to make sure. Okay, we did the abducens earlier with the trochlear nerve. Next is cranial nerve number 7. This is your facial nerve. So I'm just going to ask you to do various facial expressive movements, and then you are going to identify different tastes. We'll see in your kit how many associated tastes that there will be here. So let me start with the expressions first. I actually have a list of them in front of me. If you are able to, can you smile? There you go. Can you raise your eyebrows? Raising eyebrows. Can you frown? Okay, can you puff your cheeks? Can you close your eyes tight and don't let me open them? Close your eyes tight. Close your eyes tight. Close your eyes tight. Good, good, good. Awesome. So here, let me make note. This kit comes with the tasting ones as well. There we go. Let's see which flavors we're going to have you try. And of course, you're not allergic to anything, right? Okay, just making sure. So let's see. See, I don't want anything too great. No cilantro in this one, I swear. I would never do that to anybody. Okay. I'll do that one. Okay. Okay. All right. Okay, so we have your little taster vials. So with this one, if you wouldn't mind just sticking out your tongue, and then I'm just going to spray directly on there. Okay. Yes. That was coffee. All right. Next one. Ready? It's a little bit harder, yeah. Cinnamon. Okay, let's see what this next one is. Oh, okay. Ready? Close, close, close. Cherry. That one does trick people quite a bit there. Okay, let's try this one. Cola. Yep, like Coke. And then this last one. Sorry, I probably should have gotten you water after all that. Banana. Yeah, that one's pretty distinctive of flavor, isn't it? I'm gonna have to agree. All right. So, we did that one very good. All right. So, cranial nerve number 8. This is the vestibular cochlear nerve. So, we're just gonna ask. It's basically assessing sound waves, and how well your hearing is. So let me close this up here. Now with this one, you're just going to have to close your eyes. And I am going to be hitting a tuning fork. And you just have to tell me when you hear the sound and when you no longer hear it, okay? Awesome. All right. Close your eyes. also tell me what side you hear it. Doing great. Good. That tuning fork does not want to sound. Next is going to be a different sound. It's a clicker sound. So keep your eyes closed. Let me know when you hear the click and what side. If you could let me know how many clicks as well. Good. Pass that. All right, next is cranial nerve 9. This is the glossopharyngeal nerve. So, let's see. Oh, this is when I'm going to have to test the gag reflex. I'm so sorry. People have mixed opinions about this one. I'm not going to lie. Yeah, I know. It's the one probably not relaxing part about this exam. All right, so. Okay, let's see. Can you yawn for me? Good. All right, and then can you say, ah? Gotta do it one more time, ah. You do have that reflex. Okay. So, next is cranial nerve 10, the vagus nerve. Can you just do a swallow motion? Awesome. And then can you say a sentence for me? Yep, voice sounds good. The next is cranial nerve 11, the accessory. Can you shrug your shoulders? Okay, try and resist me. And then can you move your head to this side, but I'm going to resist. Move your head this side and look this way. Okay, very good. Cranial nerve number 12, hypoglossal nerve. Let's see. This is just the tongue. So if you could stick out your tongue and then side to side, up and down movement. You are done. That's it. That was the last cranial nerve. You did excellent. Let me put in the system that you completed it. So I'm going to input everything that I wrote here into the computer. And then what will happen is I will email you the results, kind of showing you the statistics on average, you know, what people in your age range usually score for these examinations. But I mean, I think you did pretty great. How are you feeling? How was that experience? Okay, yeah, you know, I would love to hear your feedback. So if you could leave a review comment down below just to let me know if you would ever come back and see me and do examinations like this. Because if there's a lot of people that want to, I can definitely increase my hours at the cranial nerve clinic. So yeah, just keep me posted if you really enjoyed this. Otherwise, it was very nice to meet you, very nice having you here, and I hope you enjoy the rest of your day. See ya!